Dr. B here, doing a series on the Mentally Strong Method. I'm Cristi Bundukamara, psychiatric nurse practitioner with over 20 years of clinical experience, and I created the Mentally Strong Method, mostly because I needed to do cognitive behavioral therapy on myself. And so today we're going to be focusing on anxiety. Oftentimes, people talk about anxiety. I have anxiety. I can't do this because I have anxiety. I can't is often what I hear when talking to people that are experiencing overwhelming anxiety. And what happens with anxiety is that you also start to develop a physical symptom of that anxiety, right? Your heart rate increases. Maybe you start sweating on your palms, you get flush. There's actually a physical manifestation of anxiety. And then there's that fear that someone's going to see that physical manifestation, which feeds into more anxiety. Anxiety is fear. Whether you've identified that fear or not, you need to acknowledge, I'm challenging you to acknowledge that anxiety is fear. And so the first part of the Mentally Strong Method is that we put those thoughts on paper. What makes you anxious? What's made you anxious in the past? Did you ever feel anxious as a child? And some people are naturally or more prone to anxiety than others. And there's so many things that are an imprint to your personality. We talk about, personality testing that we do, the Myers-Briggs, and then there's personality disorders, and then there's, all kinds of your astrology sign, and the time that you were born, and the number you were born on, the way that you were raised, your first impressions in the world. There's so many things that are the imprint for your personality, and some of us are more anxious than others, but we all experience anxiety, and we all can control it. Okay, maybe you can't not be anxious, but you can control your physical response to that anxiety. And if you're having significant difficulty with that, then there is medication to help. And I recommend just antidepressants, things that increase neurotransmission, because the theory is that there's not enough neurotransmission when there's this overwhelming anxiety. But we can all get to the point of overwhelming anxiety if things just keep happening over and over again. And this fear component just kind of piles in on you. That's what anxiety is. It is fear. So let's go through the Mentally Strong Method and identify what is it that we are afraid of. Anxiety is a separate category, because what often happens with anxiety is you can identify the anxiety, you can maybe start to improve in that anxiety, but then you have these negative things that continue to happen around that, right? So actually just right now, as I'm talking, one of my anxieties is my daughter okay? And so she has seizures, she has to be watched, and I'm sitting here talking to you about anxiety, and I hear her scream upstairs, and you might have heard it a little bit in the background, and you might have heard Jada go out to check on her, and there's people upstairs watching her. But in the midst of trying to share with you about anxiety, the one thing I'm most anxious about was triggered, right? There's this external thing that happens that shot my heart rate up, and I had to make a decision. Am I going to react? Am I going to, what am I going to do? And I chose to move forward with the video because I know there's people up there watching her and those kinds of things. But in another situation, I might have chose to stop and go, obviously, check on her. And so, learning how to control that anxiety, control your response to that anxiety, actually control your heart rate. There's therapies out there like biofeedback and those kinds of things where you can actually learn to decrease your heart rate. This is why we always talk about deep breathing. In your autonomic nervous system, right? Because that's where anxiety, like the physical symptoms of anxiety start to overwhelm, you can actually control that with your breath, because your breath is the only part of that system that you actually have control of. Because people are telling me, I can't control this, I'm having a panic attack. And we always tell you, take a deep breath, breathe deep, and people always tell me, I can't, it doesn't work. But I'm telling you, it's the only part of that system that you have control over. So if you get control of your breath, you can control the physical symptoms of anxiety. But long term, with the Mentally Strong method, this is what we do. We think about it, we figure out where it's coming from, we organize it, we identify this is anxiety. What am I going to do about it? Okay, I'm going to learn these coping skills. I'm going to learn grounding techniques. I'm going to learn how to control the physical symptoms with my breath. But then I'm also going to learn how to reframe that anxiety. How can I not be so afraid? What's the worst thing that could happen? Could I handle that? What's the likelihood of that, right? And it's okay to be fearful and plan for the worst, but you also have to hope for the best and put more energy into the best possible scenario rather than energy into the worst possible scenario, which is what anxiety is. It's putting energy into that worst possible scenario. So that's why in this section we also go through percentages. How much are you afraid that something's going to, for me, like, what's the percentage of my fear that something's going to happen to Maya? Well, she has a terminal condition and she will likely pass away from that condition, right? So but that piece is anticipatory grief, right? What is the likelihood that something's going to happen to her today? Maybe 20-30%. Way less than that she would actually die today. But she could have a bad seizure, she could get hurt, 20-30%, right? Am I going to put all of my energy and into, oh my gosh, is something going to happen to her, or am I going to put my energy into, I think she was just up there laughing, having a great time, and putting my energy there. So being prepared, it's okay to have anxiety. Anxiety is a normal feeling. Mild anxiety actually helps you be the most productive, right? You're going to make sure things get done and they get done right when you have that mild anxiety. But when it gets up to moderate, it starts to begin impeding your function. And when it's severe, you can't function. You're not getting anywhere. You're putting all of your energy into that fear instead of energy into the positive. So learning to manage and control that. And if you think you need help with that, learn the Mentally Strong method, get some professional help. Let's get on this journey to be mentally strong, because I truly believe that you are mentally strong.